The birth announcement arrived in my email at 2:17 p.m. on a Tuesday, mixed between dental appointment reminders and grocery store coupons. Baby Ethan Michael Harrison, 7 pounds 6 ounces, born October 15th. Mother and baby doing well. The same last name that had been mine for 8 years, attached to a child whose existence shattered every lie my husband had told me about why we couldn't have children. My name is Dr. Rachel Harrison, and for 5 years, I'd been undergoing fertility treatments while my husband David assured me that our inability to conceive was just one of those medical mysteries that affected some couples. He'd held my hand through hormone injections, IVF failures, and the devastating monthly confirmations that another cycle had failed. What I didn't know until that birth announcement arrived was that David's fertility had never been in question. While I'd been blaming my body for our childlessness, he'd been proving his reproductive capability with his research assistant Jennifer, and planning a future that included the family I'd always dreamed of, just not with me. David thought he could maintain his marriage while building his real family in secret, using my supposed infertility as cover for why we'd never have children together. What he was about to discover was that some secrets can't stay buried when they're sent to someone who specializes in reproductive endocrinology and understands exactly how male fertility actually works. Picture this: a fertility clinic in downtown Chicago where I'd spend my mornings helping couples navigate the complex journey toward parenthood while secretly struggling with my own unexplained infertility. As a reproductive endocrinologist, I understood every aspect of human fertility, except why my own body seemed incapable of the pregnancies I helped other women achieve daily. My practice specialized in complex fertility cases where traditional approaches had failed and couples needed advanced reproductive technologies to conceive. I'd built my reputation on solving medical mysteries, identifying hidden causes of infertility, and designing treatment protocols that helped seemingly hopeless cases achieve successful pregnancies. The irony of helping other women conceive while failing to get pregnant myself wasn't lost on anyone, least of all David, who'd been remarkably supportive throughout our fertility journey. "Rachel, you help so many couples every day. Our time will come. Maybe it's just the stress of your work affecting your hormones. These things happen when they're meant to happen." For 5 years, I'd been both doctor and patient in the fertility world, undergoing every test, trying every protocol, and analyzing every failed cycle with the clinical objectivity that had made my practice successful. My hormone levels were optimal. My reproductive anatomy was textbook normal, and every diagnostic test suggested I should have no difficulty conceiving. The only variable that had never been thoroughly evaluated was David. His initial semen analysis 8 years ago had shown adequate parameters, and he'd been resistant to follow-up testing, claiming that repeatedly performing on demand was affecting his stress levels and potentially impacting our natural conception chances. As a reproductive specialist, I knew that male fertility could change over time due to age, stress, environmental factors, or underlying health conditions. But David had consistently deflected suggestions for updated fertility testing, preferring to focus on optimizing my reproductive health through increasingly aggressive treatments. "Maybe we should consider using a donor," David had suggested after our 4th IVF failure. "There's no shame in needing help, and you've seen how successful those treatments can be for your patients." Looking back with professional hindsight, David's eagerness to move toward donor conception should have triggered more clinical curiosity about why he was so willing to bypass potential male factor issues. But grief and hope had clouded my medical judgment in ways that would never have happened with a patient's case. The fertility treatments had consumed 5 years of our marriage, tens of thousands of dollars, and significant physical and emotional toll that had strained our relationship in ways I'd attributed to the stress of infertility rather than questioning whether our infertility was even real. The birth announcement that arrived on Tuesday changed everything. Not just because David had a child I'd never known about, but because that child's existence proved that every assumption I'd made about our fertility challenges had been based on incomplete information. And as a medical professional who specialized in fertility, I was uniquely positioned to investigate exactly what information had been withheld. The birth announcement included details that immediately triggered my medical training. Baby Ethan's birth weight, gestational timing, and the absence of any complications suggested a healthy pregnancy resulting from normal fertility. More importantly, the timing indicated conception had occurred during a period when David was supposedly supporting me through our most intensive fertility treatments. Using my professional access to medical databases, I began investigating David's actual fertility status, with the same thoroughness I'd apply to any complex case. His employment records showed he'd been working as a research coordinator at Northwestern Memorial, where occupational health screenings were required annually. What I discovered in David's employee health records was devastating. His most recent physical examination included comprehensive blood work that showed optimal testosterone levels, normal reproductive hormone profiles, and perfect health markers for male fertility. The man who'd been suggesting donor sperm for our treatment had test results indicating superior reproductive capability. But the real breakthrough came when I cross-referenced David's work schedule with my fertility treatment timeline. Every time I'd been undergoing egg retrieval, embryo transfer, or high-stress procedures that required careful timing, David had been traveling for research conferences that coincided perfectly with my most vulnerable medical moments. Using professional networks, I contacted colleagues at conferences David claimed to have attended over the past 2 years. What I learned was that while I'd been injecting hormones and monitoring ovulation cycles, David had been maintaining a relationship with Jennifer Walsh, a graduate research assistant who worked in reproductive biology, someone who would understand fertility timing even better than most women. The timeline was perfect in its cruelty. Jennifer's pregnancy had progressed through every month when I'd been failing to conceive. Believing our infertility was unexplained, while actually competing unknowingly with a woman who'd been receiving the fertility that should have been directed toward our marriage. As a reproductive endocrinologist, I understood exactly how calculating David's deception had been. He'd used his knowledge of my treatment cycles to time his absences, his familiarity with fertility testing to avoid follow-up analysis, and his awareness of my emotional investment in motherhood to manipulate my focus away from questioning his role in our childlessness. But David had made one crucial error in his deception. He'd lied to a medical professional who specialized in the exact type of investigation needed to expose his fraud. Using forensic reproductive analysis, I could prove not just that he'd been fertile throughout our treatment period, but that he'd deliberately withheld sperm samples during my most promising cycles. My clinic's records showed that David had provided samples for our fertility treatments on specific dates, but when I analyzed the timing against Jennifer's pregnancy, I could demonstrate that his peak fertility periods had been dedicated to conceiving with her rather than supporting our medical interventions. David thought he could use medical complexity and emotional manipulation to hide his fertility while maintaining both relationships. What he was about to learn was that some deceptions can't survive investigation by someone who understands reproductive medicine better than the person attempting the fraud. I wasn't going to confront David with emotional accusations about his affair. I was going to present him with medical evidence that would prove he'd committed systematic fraud against both his wife and his girlfriend, while manipulating fertility science to serve his deception. I scheduled what David thought would be a dinner conversation about next steps in our fertility journey for Thursday evening. What he was actually walking into was the most comprehensive medical presentation of his life, one that would demonstrate exactly why you should never lie to someone who specializes in the field you're lying about. I'd prepared David's case file with the same thoroughness I'd use for presenting complex fertility cases to medical colleagues. Every piece of evidence organized chronologically, every medical finding documented with clinical precision, every deception mapped against reproductive timelines that proved systematic fraud. "You seem different tonight," David observed as he entered our dining room, where I'd arranged medical charts and fertility reports like evidence in a malpractice case. "Is this about starting a new treatment protocol?" "In a way, yes. I want to review our complete fertility history and discuss some new information that's come to light about our case." I opened David's file folder and began presenting his fertility case with the same professional detachment I'd use when teaching medical students about complex reproductive scenarios. "David, I've completed a comprehensive analysis of our 5-year fertility journey, including examination of all medical records, treatment timelines, and outcome data. What I've discovered represents one of the most systematic cases of medical deception I've encountered in my practice." I laid out David's employee health records showing optimal fertility markers, his work schedule proving deliberate absence during my treatment cycles, and Jennifer's pregnancy timeline demonstrating conception during periods when he'd claimed to be supporting our fertility efforts. "Rachel, I don't understand what you're suggesting. You're presenting this like some kind of medical case rather than discussing our marriage." "David, this is a medical case. You've systematically defrauded a reproductive endocrinologist while manipulating fertility science to maintain dual relationships. Let me walk you through the evidence." I presented each element of his deception with medical precision. The fertility testing he'd avoided, the treatment cycles he'd sabotaged, the periods when his sperm should have been available for our procedures but was being used to conceive with Jennifer. "Your recent health screening shows testosterone levels in the 95th percentile for your age group, sperm production indicators that suggest exceptional fertility, and reproductive hormone profiles that contradict every explanation you've given me for our conception difficulties. Furthermore, Jennifer Walsh's pregnancy timeline indicates conception occurred during the exact period when you were supposed to be providing samples for our IVF cycle in March. Instead of supporting our fertility treatment, you were actively conceiving with someone else? This is insane, Rachel. You're analyzing our marriage like a medical experiment. Jennifer and I, it's not what you think." Rachel, delivering final clinical judgment. "What I think, David, is that you've committed fertility fraud while manipulating a medical professional who specializes in exactly the type of reproductive analysis needed to expose your deception. You've used my emotional investment in motherhood to hide your systematic betrayal of our marriage." The silence that followed was profound. David sat surrounded by irrefutable medical evidence that proved he'd been fertile throughout our treatment period while deliberately preventing our conception in favor of building a family with Jennifer. "The child you've conceived proves that our infertility was manufactured rather than medical. You've stolen 5 years of my reproductive life while lying to a doctor who trusted your reported symptoms rather than demanding comprehensive testing." What happened next was something I'd never experienced in medical practice. Watching someone realize they'd been caught in systematic fraud by someone who possessed both the emotional motivation and professional expertise to expose every aspect of their deception. "Rachel, please. I know this looks bad, but you have to understand. I never meant for it to go this far. Jennifer and I, it just happened, and when she got pregnant, I couldn't just abandon her. David, this didn't just happen. You've been systematically manipulating fertility science while defrauding someone who makes a living helping couples conceive. This represents calculated reproductive fraud spanning multiple years." I continued my presentation with clinical objectivity that made David's emotional appeals seem irrelevant compared to the medical facts. His avoidance of follow-up fertility testing, his strategic absence during my ovulation windows, his encouragement of increasingly aggressive treatments that he knew would fail. But the most damaging aspect isn't just the personal betrayal. You've manipulated medical science while lying to a reproductive specialist. You've caused me to undergo unnecessary medical procedures, hormone treatments, and surgical interventions based on fraudulent information about male fertility factors. David, do you understand that your deception constitutes medical fraud? I've administered treatments, prescribed medications, and performed procedures based on incomplete information that you deliberately withheld. This isn't just adultery. This is systematic healthcare fraud. As both a medical professional and a victim of medical fraud, I understood exactly how serious David's deception was from legal, ethical, and professional perspectives. He'd manipulated medical care while causing physical and emotional harm through unnecessary treatments. What are you going to do? Are you going to report this to medical boards? This could destroy my career, my relationship with Jennifer, everything. David, your career should be destroyed. You've committed fraud against a medical professional while manipulating fertility science. Your relationship with Jennifer was built on lies about your marriage status and family planning. Everything you've built deserves to be destroyed because it was built on systematic deception. I explained exactly what David's fertility fraud would cost him. Medical board investigation for patient deception, potential criminal charges for healthcare fraud, professional consequences at Northwestern Memorial for ethical violations, and divorce proceedings that would expose his systematic manipulation of medical treatment. You thought you could lie to a reproductive endocrinologist about fertility while stealing years of my reproductive life to build a family with someone else. What you're about to learn is that medical fraud has consequences that extend far beyond personal relationships. David's face went through the kind of transformation I'd seen in patients when they finally understood the full scope of their medical diagnosis. The comfortable fiction he'd maintained was collapsing under scientific evidence that proved systematic deception rather than unexplained infertility. Jennifer doesn't know about the fertility treatments you've caused me to undergo, does she? She doesn't know that while she was conceiving your child, I was injecting hormones and undergoing procedures that you knew would fail because you were deliberately withholding your fertility from our marriage. Within a week, David's systematic fertility fraud had triggered investigations that extended far beyond our personal relationship. As a licensed medical professional, I was obligated to report healthcare fraud, especially when it involved manipulation of fertility treatments and patient deception. The Illinois Medical Board opened an investigation into David's interference with fertility treatments, which constituted unlicensed practice of medicine and patient fraud. Northwestern Memorial launched their own inquiry into ethical violations by an employee who'd manipulated medical information while maintaining dual relationships. But the most devastating consequence came when I contacted Jennifer Walsh directly to provide her with medical information that would help her understand exactly what kind of man had fathered her child. Miss Walsh? This is Dr. Rachel Harrison. I'm a reproductive endocrinologist, and I need to discuss some important medical information about David Harrison that I think you should know before making decisions about your future with him. Dr. Harrison? I don't understand. David never mentioned that you were a doctor. He said you worked in medical administration. David has provided you with incomplete information about several aspects of his life. I think you deserve to know that while you were conceiving his child, he was married to me, and we were undergoing fertility treatments based on his claims that he was unable to father children. What followed was a conversation that revealed the scope of David's deception to both women. Jennifer had believed David was divorced and that their relationship represented his first attempt at starting a family. Learning that he'd been married throughout their relationship, while actively preventing conception with his wife, transformed her understanding of his character. He told me that his marriage had ended because of irreconcilable differences about having children. He said his ex-wife didn't want kids, and that's why they'd separated. Jennifer, His ex-wife is a reproductive endocrinologist who spent 5 years undergoing fertility treatments, while he deliberately sabotaged our efforts to conceive. He's lied to both of us about fundamental aspects of fertility and family planning. What amazed me was how quickly Jennifer and I moved from mutual discovery to collaborative response. Both of us had been medically and emotionally manipulated by someone who'd used our reproductive biology against us while lying about his own fertility capabilities. 6 months later, David had lost his position at Northwestern Memorial, faced professional sanctions for ethical violations, and was paying both child support to Jennifer and substantial financial settlement to me for medical fraud and fertility deception. The medical board's investigation had resulted in a published case study about fertility fraud that was being used to train healthcare professionals about recognizing and reporting systematic patient deception. David's case had become a cautionary tale about the intersection of medical fraud and reproductive manipulation. Meanwhile, I'd transferred to a fertility clinic that specialized in helping women whose reproductive health had been compromised by partner deception. My experience with David's fraud had opened an entirely new area of medical practice focused on supporting victims of reproductive manipulation. "Dr. Harrison, thank you for taking my case," said Maria Santos, a patient whose husband had been secretly having a vasectomy while she underwent fertility treatments. "When I heard about your experience, I knew you'd understand what it feels like to have your reproductive health used against you." 2 years after discovering David's fertility fraud, I was sitting in my new office at the Reproductive Justice Center, reviewing cases that involved systematic partner deception and medical manipulation. My experience had led to establishing the first clinic specifically designed to support women whose fertility had been compromised by deliberate deception. The center provided both medical treatment and legal support for women who discovered that their unexplained infertility was actually the result of partner manipulation, sabotage, or fraud. We'd helped dozens of women understand that their reproductive challenges weren't medical failures, but deliberate deceptions. Jennifer had become an unexpected ally in this work, sharing her experience about how men could manipulate multiple women simultaneously by controlling information about fertility and family planning. Her willingness to speak publicly about David's deception had helped other women recognize similar patterns in their own relationships. David's case had also led to legislative changes in Illinois that made fertility fraud a specific criminal offense rather than just a civil matter. The Harrison Law now provided legal recourse for women whose reproductive health had been deliberately compromised by deceptive partners. I'd been invited to speak at medical conferences about reproductive coercion and fertility fraud, where I shared techniques for identifying cases where male partners might be deliberately sabotaging conception while maintaining the fiction of shared infertility struggles. The most unexpected outcome was my own pregnancy 6 months after David's fertility fraud was exposed. Working with a reputable fertility specialist who had no reason to withhold accurate male fertility assessment, I'd conceived naturally within 3 cycles, proving that my reproductive health had never been the problem. "You know what's amazing?" Jennifer had told me during one of our coordination meetings for the center's advocacy work. "David thought he could control both our reproductive futures by manipulating medical information. Instead, he gave us the expertise to help other women avoid the same deception." David had thought he could maintain his marriage while building his real family in secret, using my supposed infertility as cover for why we'd never have children together. What he'd discovered was that some deceptions can't survive investigation by someone who specializes in exactly the medical field you're lying about. He'd stolen 5 years of my reproductive life while proving his fertility with someone else. But those 5 years had taught me exactly how to identify, expose, and prevent the kind of reproductive fraud that he'd committed against both of us. Sometimes, The best revenge isn't personal. It's using your professional expertise to ensure that other women never experience the same medical manipulation and reproductive deception that nearly destroyed your faith in your own body. I'd thought we were infertile. He'd just had a kid with someone else. But discovering his deception had led to breakthrough work that protected countless other women from similar reproductive fraud. And my own child, conceived naturally once the deception ended, would grow up in a world where fertility fraud was recognized, prosecuted, and prevented.